So if I can say hello and welcome, and I'm going to recognize the Lotto Community Fund who funded the project that we are hosting today. So the project Better Together has been initiated on the grounds of how can we make our health better and how can we improve the health and how can we recover from the COVID pandemic. And as we are all aware, the BAME, which is, I'm sure everyone knows what it stands for now. The Black Asian joined this meeting today are BAMEs. And I'm hoping there are others who will join and support us as well as we work towards improving the health. So that is our poster. And as you can see, it's behind me as well. And while we are recovering from COVID, our main aims are, as our poster says, to reduce loneliness and isolation, to improve our mental health by doing that, to meet once a month and talk about issues that will help us recover from the COVID pandemic. We, as today, as you can see from our topic, we are promoting good health and well-being. And this project will also look at promoting counseling, promoting or mental health for not only the ladies, although it is founded by the ladies, but from it will also include children. This meeting is being attended by young ladies as well. Anyone above the age of 12 can attend this meeting, but we also have other activities that involve younger children. We are having fun this afternoon, and I'm hoping the games team will also help us have some fun, forget our COVID problems, and hopefully continue to be healthy together. So we launched on the 21st of March, and there are exciting afternoons that are coming. And like I said, we are aiming to do this once a month for the next few months, hopefully coming into 2022. And after the COVID pandemic, we're hoping we can meet face to face and participate in either fitness programs, cooking, makeup, flower arrangements, art, anything that will be useful for community support. So if you think of any other ideas or anything else that can be added to this, that will be very welcome. So I'm sure you know why we chose this topic, and we have been in the news. The BAMEs have been in the news. There is lots of news that have come out, and I've just taken that screenshot for this presentation where it says Black people are 4 times more likely to die from COVID pandemic. And I'm sure we all know now that. And the important thing is that what are we doing about it? The authorities, I can say the health professionals or the politicians, and on different fronts of work, there is a lot of work which is happening to try and improve the health outcomes of Black and Asian minority ethnic groups. And what we are going to discuss today is, while the authorities, while the hospitals are working on this topic, what can we do ourselves in the community? What can we do to help ourselves? And I'm not speaking, although I am a healthcare professional, I am also wanting to think like a patient and say, if I was the patient, what can I do myself to improve my health? So this afternoon, I'm hoping to inspire, to motivate, to remind ladies to say, think about what you can do, think about the difference that you can make either as an individual or as a community to improve our health. The inequalities in health are massive. They are not only just on COVID. So I will introduce some of them in this talk, but what's more important is that as ladies, we are inspired to be aware of the health inequalities that are there and be attentive to them in our everyday, either at work, at home, in our personal lives, and say, how can we balance that? How can we reduce the inequality of our health outcomes? So I'm sure you know why we've chosen this topic. I've got this graph just for you to have a look and see what, in terms of the proportion. So I'm just wanting to draw your attention to the proportion of what COVID has done to the Black minority in terms of deaths. And as you can see, the Black Caribbean are the most affected, and they had the most deaths, and then the Black Africans, and then we can see the Bangladeshis, and then the Indians to a lesser extent. We are talking about those in England. We are not necessarily talking about worldwide. So if you compare this to the white levels or the white British levels, as you can see that the difference is massive. How can we explain this difference? Yes, in the medical fraternity, they are working hard to look at research, to look at numbers, to look at risk factors, and to work on them. But what we are concentrating today is in the community, in our lives, what can we do to improve this and to reduce the inequality? The moment of silence to the healthcare workers and all BME communities who have died during the pandemic. This is just one of the pictures, but as you can see, the Black and Asian faces are the majority in this picture. And if we look at those who have been ill as well, the Black and the Asians are the majority. And what we are saying is let's learn from this and think about what can we do. And we pray for these souls to rest in peace. But at the same time, those who are still here, let's think about ways we can make a difference. Next slide. It's not surprising that the health professionals, the Black and Asian population had the highest impact. It just got me to start thinking how much or how many of the non-British population are in the NHS or are working in the health professional sector. In proportion, we would say there are many. If you would like to look at these numbers, I can send them to you. But obviously, because we are in Britain, the majority, nearly 1 million staff are from Britain. But as you can see, India, more than nearly 20,000 from the Philippines, nearly 15,000. And then even from small countries like Zimbabwe, you're nearly 4,000 who are working for the NHS. A lot. So while we are saying Blacks and Asian minority are dying from COVID, what we are just trying to talk about today is to say COVID-19 is only one of the conditions where the Black and Asians are dying from. Otherwise, there are other health conditions where the BAMEs are actually having much poorer outcome than the local population. So while we are talking about COVID-19 today, let's also focus on other health conditions where the BAMEs are actually dying from or are actually having poorer outcomes, and I will talk about them briefly in this afternoon. So the reason why I put in this slide is just to highlight that it is not only COVID where the Black and Asian minorities are more affected than the local population. So this is coming from Embrace, which looks at the maternal outcomes like pregnancy, outcomes for pregnant women in the UK, and it looks at the populations and the outcomes and the deaths. So I'm just giving you an idea of stillbirths, for example. We all know what a stillbirth is, when a baby is born with no signs of life, and usually by definition is after 24 weeks. But any baby that is born with no signs of life is a loss of life. So if we look at the white women and we count per 100,000, as you can see that out of 100,000 women, white women who give birth, 8 will have stillbirths here in the UK. This is a sad loss to each and every one of them. So I am not disregarding the fact that it is a loss to every woman to give birth to a baby who is not alive. But as you can see, the Asian women, it then nearly doubles to 15 women per 100,000. And then can you see then what happens to the Black women? You're talking about 5 times the same number of women who will give birth to a baby that is not alive. So this should get us thinking to say, what else? What can we done? What can we do? Yes, some of the reasons are they cannot be helped, but in the health sector, certainly in women's health, a lot of work is going on to find out reasons why the difference should be that much when we are all living in the same country, where healthcare is free for everyone, for the NHS, especially maternity health. The majority of all pregnant women will be looked after in the NHS hospital. But why should then Black women be 5 times more likely to give birth to a baby that is not alive? So this is just an example. There are other outcomes that I have not mentioned here, but outcomes like preterm births, like babies who are going to be needing special care and staying in the intensive care unit, we are also faring much higher than the local population. If you look at the babies that are born small, that are likely to have problems, we are also faring much higher than the local population. So if you look at mothers who actually die because of pregnancy, the Black and Asian women are more likely to die, and the numbers and figures have shown that. So yes, there is a lot of work that is happening in the hospitals, in the government. There's a lot of money and budget and time that is being allocated to help to improve this inequality. But the purpose of this afternoon is to just raise awareness so that we know, or we get to hear, that these inequalities are there, and what can we do ourselves to improve our own health. What is happening now, which Benash, who was going to come today, and hopefully she will come on one of our sessions, is actually raising awareness. And it is called every maternity unit is going to go through what we call cultural awareness competency assessment. And it's also important to know that there are some ways where women can actually contribute. There is something called Maternity Voices Partnership, where you can actually join the partnership to actually voice on behalf of BAME women. So we may not have the privilege to choose who our doctors are, but we have the responsibility to raise awareness, to actually make sure that the doctors, the nurses that are looking after us are actually culturally competent. So there's something now called cultural intelligence. So as women, we also need to be culturally intelligent, which means we are learning about different cultures. It is quite common to just know about the culture where you are originally from, and then the culture of the UK because you have come to live here, and then you blind yourself against other cultures, either of the Asian women or Caribbean women or other cultures, maybe in East European. So a cultural intelligence needs to increase among both patients as well as the carers. So yes, it is work that is going on, and it needs everyone's awareness and participation to make sure that these inequalities are talked about, and then for everyone to make an effort to reduce these inequalities. So I'm going to just do a short presentation from what Benash had prepared. The reason why I invited her to be a part of our project is that she's doing a lot of work to raise this awareness. She is actually employed as a cultural liaison, a midwife at Bolton Hospital. One thing I just want to encourage women of color is that whatever diagnosis you are given or condition that you are given when you go to the hospital, do some research about it and learn and read around it. So if they give you leaflets, please read them. Let's not, there was a saying which said, if you want to hide something from Black people, put it in a book. They will never read it, they will never find it. So let's just encourage each other to say, let's read. If they say you've got endometriosis, just find out what is endometriosis, read about it, so that the next time you actually see a doctor, you can have an informed conversation about it. So knowledge, and also it's important to find the knowledge in the right places. So find the knowledge either on the NHS website or on related website that is either supported by the NHS or supported by the hospital, so that we do not get information that is not verified, information that comes easily on WhatsApp groups forwarded from different people, different opinions. So it's just important to know where do we gain our knowledge. So for now, I will just go on to Benash's profile. So like I said, she's a cultural liaison midwife, but I just want us to look at her profile to see what she does and what difference she's actually making for her Asian community. So in addition to being a midwife, she participates in key board meetings or key charities that actually make a difference. So what I'm just encouraging women in this platform is to say that keep your ears open, keep your eyes open wherever you are. If they want volunteers to sit on a board, or if they want volunteers to work on some project, either in the hospital or at work, please do volunteer for those positions. So while she was preparing for this, she was just talking about what we know about COVID-19 and risk factors to it. Like I said, I'm not wanting to turn this into a classroom lecture, but I'm just wanting to remind that conditions, if you have long-term conditions, especially any conditions that that reduce your immune system, any conditions that are long-term, like cancer-related, having chemotherapy or radiotherapy. Although these are rare, but then you are then more likely to suffer from COVID. But more commonly, we have long-term conditions like high blood pressure and diabetes. And those are conditions where we can actually say, or we will touch on this afternoon, because they are more common and quite a number of us will have them, especially type 2 diabetes. We may not have it now, but as we grow older, we are more likely to actually have type 2 diabetes. So what we're saying is, let's look at these areas where we can actually make a difference, and know them as risk factors, not only for COVID-19, but also risk factors for other conditions. And then apart from high blood pressure and diabetes, a lot has also to do with our weight and lack of exercise. So we will touch on that as well. And this project is also going to be encouraging exercise and fitness, which will hopefully help improve our health. So blood pressure is common. A lot of, especially Black women over the age of 40, they go around with high blood pressure, and they may not even know that they do have high blood pressure. So just think of, when did you last have your blood pressure checked? And usually, as Black or Asian women, we are unlikely to even have our blood pressure checked until the time when we are actually sick and have gone to hospital. But if we are healthy and feeling well, we really may not even have our blood pressure checked. So something simple like check your blood pressure, pass through a pharmacy and ask. So some of the signs of type 2 diabetes or of diabetes are, if you're really waking up at night several times to go for a wee, it's not normal. It may not be type 2 diabetes. It could be maybe problems, or urinary problems, or urine infection, or bladder problems, or incontinence problems. But then it shouldn't be, you shouldn't wake up more than twice or at night to just go for a wee. If you're feeling thirsty, drink. But if you continue to drink and still feeling thirsty, just have it tested. It doesn't take long to get it tested. A blood test or at your GPs can get you a test for diabetes. Some of these signs may be subtle, but if you have a repeated thrush that never goes away, or if you have wounds or cuts that take long to heal, or if you think your vision is just getting blurred and you're not seeing, the usual way that you would normally see, so just have it checked, just to make sure that you don't have it. So exercise, we all know, but we also know that it is very difficult to convince Black women to exercise, including myself. I may try, but it's not easy. We tend to think we are busy doing other things, and we don't have time to exercise. But let's just remember, every time you exercise, you are actually investing into your future, into a future body or a future health that you will thank yourself in old age. So exercising does not necessarily mean that you actually go out for a run. If you go out for a run, that's fine. But if you just climb the stairs instead of taking a lift over 2 floors, or you walk faster than usual rather than drag your feet, and you just be aware that you can walk fast instead of walk slowly, know your weight and your body mass index. A lot of us may not even know what our body mass index is. So just pay attention to exercise, because it is good for you. In this project, we will have a young team of ladies who are going to be leading us and encouraging us into this area of health. So vitamin D, I'm not sure how many of us knew that vitamin D, especially if you have darker skin. So it means that if you are black, you are more likely to have vitamin D deficiency. It also, if you wear clothes that cover most of your skin, including, the headscarves most of the time, and if you spend a lot of the time indoors, and also if you are overweight. So vitamin D tended to actually gain a lot of attention, especially during the COVID pandemic. And so get checked whether you are vitamin D deficient. If you do not know, if you have symptoms of just feeling tired all the time, bone pain, backache, muscle weakness, lots of mood changes, like depression, just feeling like crying, feeling low, vitamin D is something that you can get over the counter, or make sure that every time there's a little bit of sun, just go outside, stay outside, even if it's slightly cold, but that bit of sun will actually help us to get vitamin D. So vitamin D has actually become very, very important, especially in the Black and Asian minorities, because of our dark skin, and also because some of us do cover nearly most of our skin when we're outdoors. Looking after your emotional well-being as well is important. I'm not going to touch that in detail, but part of this project as well, we're going to have a session on mental health, and just be aware that you need to be feeling good, feeling happy. Do something that makes you feel happy. Sometimes it's nothing big. It could be singing, painting, or calling a friend, or just doing something, or some like even just putting makeup while indoors, or just getting or dressing well, dressing nice, anything that makes you feel happy. So it's important for your emotional well-being. So part of our project again is to reduce loneliness, just to have time to talk as ladies, to encourage each other, but important to know that emotional well-being is your own responsibility. So you shouldn't then be saying, oh, I'm so depressed, I'm so stressed because of my children are doing this, or my husband is doing this, or work is doing that. It starts with you. Be in sort of what I can say, the intrinsically motivated to feel well. And if you are then suffering from the mental health, or any emotional problems, then also it's important to accept and acknowledge that that is happening, and then ask for help. So there are, like I said, there are networks, there are charitable organizations that you can join. A lot of them are advertised in the hospitals or on the hospital websites for those who work in the hospitals, or for those who are teachers who work in schools. I'm sure there are organizations that are charitable. So if you are wanting to know more about this, and Benash is quite happy for us to contact her, and then just to see how and where we can make a difference.
Hello, ladies. Thank you for having me. I've just been to the stairs, unfortunately, so I'm gasping for air here. So my name is Cinderella Chikombe, and for the past few years, I've been working in NHS hospitals as a Band 5 staff nurse, and I'm currently a Band 6 now, a charge nurse for a plasma collection center in Bolton. I'll comment a few on what other health inequalities were being said by doctor. From my own experience in relation to COVID, the things I saw was the risk assessments. They were not done initially. So by the time they did them, it was a bit too late. And if you see the risk assessments they do, just by being black, you are scoring 4 already. Even if it's out of 15, you are now at 4. And then if they look at obesity, maybe you are now on 10. So technically, you shouldn't even be working there. And the challenge is nobody wants anyone to leave. They want themselves to leave, but you should be there. I had to fight for my life, not to be sent to COVID wards or to be sent to ITU at some point to help. So I think those were some of the challenges that us ethnic minority groups were having in the hospitals, that you couldn't speak up. You need to speak up and you need to have knowledge. I went and read at home and find out, oh, so if I'm black, I'm high risk. Oh, if I'm obese, I'm high risk. Then I had to challenge my seniors. I had to be put on some disciplinary channels at some point, that she's very stubborn, this one. But at the end of the day, they have to obey the law. You are high risk and you can't be moved. So the other issue is some people didn't receive GP letters, because if you are type 2 diabetic, if you are obese, if you got asthma, already you should be on fellow. But majority of my co-workers from ethnic minority, they didn't have those letters. And you'll be wondering, oh, why is that such and such and such is not here? They had their letters, and they were all like British, and they had their letters, they were not working. So I think if this happens again, if this pandemic comes back again, make sure you chase for your own letters from the GP. Just tell the GP, I've got this and this. I don't think I should be, maybe I should be fellowed. And then lastly, I also need to comment on the pregnancy. I'm very, very happy that there are some things like cultural liaison midwives which are coming up, because I also face challenges during my pregnancy. One, I can mention about scans. I knew I'm high risk and I should be having multiple scans, but they were not booked. I had to chase for them. And then I would think, what if I wasn't a medical practitioner, or if I wasn't working health? How was I going to know this? There's so many people who came here from ethnic minority who can't even read. How would they know if they are supposed to have scans? Medication, at some point I was prescribed antibiotics, which can kill the fetus, but they were prescribed to me. But because I went and read about it, that's when I went back and challenged. So it's little things like this. So it's very good to educate yourself. It's very good to read about it. I can talk about urine infections. They can affect the fetus as well. And you can be offered one sample to go to the lab. The next one, they are just doing dipsticks. But some of the things I've noticed, they are not picked up during the dipsticks. But if I wasn't working in health, I wouldn't have challenged that. So I'm just saying to us, let's read about it, whatever condition, like the doctor said, read about it, and maybe it can make a difference in future. So I'm also going to talk about other things which were not spoken by the doctor before, other health inequalities that we can have. So I'm going to talk about health screening, just to encourage us ladies to get health checks. All right. Screening apparently is just a way of checking on healthy people if they've got any particular conditions. It doesn't mean that you had a negative swab today. It doesn't mean that tomorrow you might not have it. So for example, we can talk about cervical screening. Ladies are entitled to cervical screening. Women aged 25 to 64, they can be checked and every 3 years, 26-year-olds to 49, it can be done every 3 years. I myself only received one letter to invite me for this screening, but I know every 3 years I can go and ask, mine is not being done, and then something can be done. So I'm here today to encourage you ladies to chase for your own screenings, especially cervical screening. 50-year-olds and above, they can have theirs every 5 years. There's also breast screening. Women aged 50 to 70, for any signs of breast cancer, you can be screened. You might not receive the letter, but you need to ask your GP, ask somebody. There's things like diabetic eye screening from the age of 12. You have to get your eyes checked. Bowel screening, these ones, if you're aged 60, you should receive the home kit at home and you can check. The only reason why I'm emphasizing is because we don't get these things posted to us. And like it was mentioned by the doctor before, it's written between the lines. We'll never know, and it's gonna be 5-6 years before you get your own cervical screening. So check with your GP, only because it's pandemic, but I know in sexual health settings, you can just attend and say, oh, I've got a what there, and they'll screen you everything. So I'm here today to just encourage ladies on these few things. Thank you so much.
Thank you, Cinderella, for that. So what Cinderella has just been emphasizing is access to screening. Yes, we may have the pandemic, but even without the pandemic, the uptake for screening has been very low with Black and ethnic minorities. So some have commented that BAME women may feel reluctant to access healthcare as they feel that they may be understood. So encouraging women to seek healthcare. And if you think you may not get the help that you require, or if you think the help that you have asked for has not been coming, speak up. So there's a question here which says, on diabetic, what are the most side effects? Can mental distances be one of them? I think someone is asking whether mental disturbances or mental illness can be one of the signs of diabetes. If it is poorly controlled, if, say, for example, you actually become or have extremely high blood sugars or very low blood sugars, you can be confused. So confusion, like acute confusion, can be a sign of a complicated diabetes. So yes, like you have said, but as a chronic mental disease, it's not necessarily a long chronic mental disease, but what sometimes can happen is if you have problems either with memory, because a part of your brain has been affected, you may then have challenges with learning disability, or you may have challenges with memory, and that can be affected in terms of long-term health.
Okay, so it's called Name This Woman. So we're just gonna be showing a younger photo of mainly famous people, and then we guess who it is. So everybody can unmute themselves. So you just yell it out loud if you think you know who it is. So I'll hand it over to, we can start with the first slide. Who is this woman? So feel free to unmute yourself so you can just say the answers if you know them.
Michelle Obama.
Okay. Yeah.
Yes.
That's correct. That is Michelle Obama. And the next one. Can you guys guess who this is? Anybody?
Give us a clue.
Okay, she was a nun, a very popular nun.
Mother Teresa.
Yes, that's Mother Teresa. Yep. Yeah, that is her.
Mother Teresa. That's correct. Yeah.
Then this one. Anybody know?
Oh no, this one. Yes.
Queen Elizabeth.
Yes.
Yes.
When she was younger. Okay, next one. If anyone can guess this one. Okay, so a hint, she is African.
Winnie Mandela.
Oh, South African.
Winnie Mandela.
Yes, that's correct. That's Winnie Mandela. That is, yeah, that's. And then this one, knows. A hint is that she's also African. She has won an Oscar.
Lupita Nyong'o.
Yes.
Oh,
yeah. That's her. That's Lupita. And then next one. We can guess this one.
This one, please.
Yes, I guess we didn't hints for that one. Yes, our very own. Our very own
Yes.
Agnes Chipeta, that's her.
Yes.
Inside of TikTok.
And then this one. And hint is she's a famous preacher. She's a very famous preacher. She's on TV.
Judy
Joyce
Jacob.
Mayer. Joyce
Yep.
Mayer.
Man.
Yeah, that's correct. Joyce Mayer.
Yeah.
That is her when she was. And I think this is the last one, last but not least.
Mhm.
Oprah.
Yes, that's Oprah Winfrey.
No.
Right.
I think that's it. That was fast. Yeah, great
Yeah.
job, everyone. That's just that. I thought we could just, get to know a few of the women since it's a women's platform.
Yeah. Thank you
Thank
very much, everyone. I'll be in touch with our winners just to arrange and see how best they can get their prizes. Thank you so much.